Assalamu alaikum. The article for this week is titled as Impact of Type 2 Diabetes Mellitus and the Occurrence of Vertical Root Fracture. It's a case control study done by PradeepKumar et al., published in Journal of Endodontics on April 2024. This study was designed to investigate the relationship between type 2 diabetes mellitus and the occurrence of vertical root fracture. In addition to that, to compare the extension of the root crack and the chemical characteristics of the root dentin in teeth with vertical root fracture from patients with and without diabetes mellitus. 132 teeth with vertical root fractures were matched with the 132 teeth without vertical root fractures as a control, and patient who had root canal treatment followed by full crown restoration were selected. Teeth with the evidence of periapical periodontal pathology without full coverage crown restoration, with root resorption, cracked teeth with poor quality of root filling, patient with a traumatic occlusion or bruxism, and third molars were excluded. Also, they excluded the patient with other associated systemic disease like hypertension and renal disease also were excluded. The presence of vertical root fracture in root canal treated and crown teeth was determined from clinical signs such as the presence of sinus tract, deep narrow periodontal pocket, symptoms like pain on percussion and palpation, and also radiographically as a J-shaped or halo radiolucency. Also, vertical root fracture was confirmed in these teeth by surgical flap elevation. Presence or absence of pre-existing type 2 diabetes with hyperglycemia was noted for cases and controls for the past 5 years from the date of root canal treatment. Teeth with the vertical root fracture were extracted and stored in HPSS for further analysis. 20 extracted teeth with vertical root fracture in the cases controlled contained 13 molars and 7 premolars from diabetes mellitus patients were matched with that of non-diabetes mellitus patients. The coronoapical course of vertical root fracture in the root was recorded following visual examination. Then the root were cross-sectioned at the coronal, middle, and apical third and were examined under stereo microscope for the extent and course of vertical root fracture in the buccolingual and mesodistal aspect. Also, to evaluate the presence and extent of sclerotic dentin and the presence or absence of isthmus and the course of a crack through these isthmus. The presence of bentosidin, collagen cross-linking ratio, and the mineral collagen ratio was determined using Fourier transform infrared spectroscopy. The result showed that when compared to patients without diabetes mellitus, patients with diabetes mellitus had 2.67 fold higher odds for occurrence of vertical root fracture. Regarding the microscopic assessment of dentine crack, extent of dentine sclerosis was more pronounced in diabetes mellitus root dentin when compared to non-diabetes root dentin, and this was statistically significant. 74 of the fracture were in the buccolingual direction, and 70% had a complete coronoapical extension. A crack passed through isthmus in 100% of the roots in patient with diabetes mellitus, while in patient without diabetes mellitus was 84%. Bintosayidine levels, mineral collagen ratio, and collagen cross-linking ratio were found to be significantly higher in root dentin of teeth with vertical root fracture and diabetes mellitus when compared to root dentin of teeth with vertical root fracture and without diabetes mellitus. So the findings of this study suggest that root canal treated teeth in patients with type 2 diabetes mellitus were more often associated with vertical root fractures than in non-diabetes mellitus patient. Also, an increased amount of sclerotic dentin was present in roots of patients with diabetes mellitus and vertical root fracture, and root dentin from patients with type 2 diabetes mellitus and vertical root fracture also showed higher levels of bintosayidine, collagen cross-linking ratio, and mineral to collagen ratio. And thank you.